Brow bone reduction, as the name implies, involves actually setting back the bone that forms the brow. This is usually done if I'm just contouring bone through an incision at the top of the head, so it's well hidden in the scalp. Brow bone reduction is good for men or women or transgender women who have a more hooding over the brow than you want, and this creates a shadow over the eyes. I set back the brow bone through a combination of techniques. One involves actually drilling down the bone itself with a medical drill. The other technique is actually setting back the front of the bone in this part in the middle. What happens is there is a pocket of air called the frontal sinus in the middle part of your forehead that if you simply drill down the bone, you would encounter that sinus. So the safest technique is actually creating a plate of bone and setting it back within the sinus. I use titanium plates and screws to set the bone back and set it in the perfect place. And you don't feel those plates and screws at all afterwards, and you wouldn't even know that they were there if I didn't tell you they were there. It heals very nicely, and I haven't had any medical issues like sinusitis afterwards, and it really brings out the eyes. So what is recovery like after a brow bone reduction? Really, the first 24 hours are the worst. You'd have an incision in your scalp, and I use surgical clips to close that. There's not a lot of care that's needed other than keeping your hair washed and keeping it clean. You don't want crusts to dry up and stick on these clips. The first 24 hours you can have some swelling around the eyes, and gravity will bring fluid and bruising around the eyes. Some patients' eyes even swell shut. That usually gets better over the course of the first 24 hours after surgery with ice and keeping your head elevated. Most patients don't have a lot of pain after brow bone reduction because you experience some numbness because the nerves within your forehead, called the supraorbital and supratrochlear nerves, actually get stretched. And so your scalp is quite numb for several months. That's probably the worst part. The first day or two, you may have some pain that's similar to a bad headache. And so, Tylenol, ibuprofen, and stronger pain meds will be given to you. And that usually controls it quite well. Most people end up taking at least a week off of work, if not more. So if you did it at the end of 1 week, took a week off, and then you'd be okay to go back to work on Monday. That being said, you see immediate results. However, you will have some swelling, and you can have some hair loss within the scalp, and that's called shock hair loss. That usually comes back after a couple of months.